Hello, I'm William E. Pelham Jr. I'm the director of the Center for Children and Families and a distinguished professor of psychology at Florida International University. The study was conducted with a National Institute of Mental Health grant to look at the effects of medication on children with ADHD. We were interested particularly in the effects of medication on their learning in school settings and on their tolerance to medication. The study was an examination of the effect of stimulant medication, the most common intervention used for children with ADHD, on their academic functioning in a classroom setting. Did they learn more about what they were being taught when they were medicated versus not medicated? This study was important because the most common treatment for children with ADHD is stimulant medication. 10% of all the children in America take stimulant medication for treatment of ADHD. One of the most important questions is, does it have any benefit in academic performance for the children who take it? The results of the study showed that stimulant medication helped children's behavior in a classroom setting, but did not help them learn more of the academic content that they were being taught. And I think almost everyone in the field thought that medication would help learning in children because we've known for ages that medication helps them behave better in the classroom. So they're less likely to violate class rules. They look like they're on task more. Naturally, I thought, along with everybody else, that they would learn more. This study showed that was not the case at all. They behaved better, but they didn't learn more. The teachers were teaching a particular curriculum that included social studies, science, and vocabulary, and we were monitoring how well they taught it and how well the children learned it. So they took tests evaluating how much they learned from the curriculum. And what we found was that when they did it on medication days, and they did it on days with no medication, that there was no difference in their performance. That is, the medication did not enhance their learning of the curricular content that the teachers taught. So the participants in the study were 173 children with ADHD between the ages of 7 and 12. We taught them in a summer school setting where we could have really careful control over what teachers taught, how much time they spent teaching it, and how well the children learned. The findings are important because more than 90% of children with ADHD take stimulant medication at some point in time, and the main goal for many children is to improve their learning in school. We studied this in a summer classroom setting because we could manipulate or control both the amount of medication and the amount that children were taught and learned in a short time period. I believe that the reason so many children are treated with medication for ADHD is because that's what physicians, who are the main people with whom parents interact about treatment for ADHD, all believe that medication alone is a sufficient treatment for children with ADHD. What this study showed is that that's not at all the case when it comes to their learning. In recent years, all the professional societies for pediatricians, psychologists, and psychiatrists have decided that combined treatment, that is, starting treatment with behavioral interventions, teaching parents and teachers skills and teaching children skills, and then adding medication as necessary for individual children beyond the psychosocial treatments is the way to go. So for classroom teachers, it means teaching classroom teachers how to manage the children's behavior in the classroom, teaching them how to use rewards and consequences to keep children on task, how to use good teaching to keep children on task. In the home setting, it means teaching the same skills to parents so that parents learn how to give good directions to children and how to provide positive consequences to kids who follow their requests. So the study that we did was a summer classroom study, and although it had really provocative findings, the next step would be demonstrating that the same thing occurs when you do it in a regular school year setting. So our next step will be setting up a study where we can look over the course of an entire school year whether children who are medicated learn better and achieve better than children who are not taking medication.